Rachel Vandenberg. I'm a naturopathic doctor, a certified healthy breast educator, and a member of the MammAlive Foundation. The mission of the MammAlive Foundation is to educate women globally in ways that they can reduce their breast cancer risk or the risk of its recurrence. And today I'm going to talk to you about breast cancer and sugar. I'm often asked in my practice whether eating sugar causes cancer. A quick Google search leads to two very different opinions on this topic. Cancer cells use sugar as fuel. So one obvious conclusion to make is that more sugar will cause cancer to grow more. On the flip side, all of the cells in our body use sugar as fuel, and our bodies break down various foods that we eat, sweets, breads, even fruits and legumes, into sugar so that it can be used as fuel. So based on this, some people suggest that there's no way that sugar will make a difference in cancer growth. In a way, both views are right, and that's just because it's likely not the sugar itself so much as the effect of the sugar on the body that affects cancer growth. Let's take a look at what happens when we eat sugar, and hopefully this explanation will help things make a little bit more sense. So what happens when you eat sugar? Let's say you eat a cookie. The sugar from that cookie goes into your bloodstream, increasing your blood sugar level. In response, your body releases insulin to tell your cells to take in that sugar. That way, your cells get the fuel they need and your blood sugar levels go back down. If all is working well, blood sugar and insulin levels should stay relatively stable. The problem occurs when you consume an overall high sugar diet. This frequent consumption of sugar leads to chronically high blood sugar, and the body has to make more and more insulin to keep up. Eventually, with all of that insulin, the cells sort of stop listening. This means that the cells don't take up as much sugar, and your body, in response, has to make even more insulin to try to get things back into balance. And there you are, left with chronically high blood sugar, high insulin, and cells that aren't really responding to the insulin levels. How does all this relate to cancer? Well, while the role of sugar itself might be a bit controversial, studies do show that high insulin stimulates the growth of certain cancers, breast cancer being among them, and that high insulin levels correlate with a worse prognosis in those patients who have breast cancer. Research also shows that cancer cells often have more insulin receptors than our healthy cells, which means they're even more affected by the high insulin levels than our healthy cells are. And to complicate things further, another hormone called insulin-like growth factor, or IGF-1, also increases with high blood sugar levels. And IGF-1 also stimulates tumor growth, and it inhibits the breakdown of cancer cells. So if you eat an overall healthy, low-sugar diet, one piece of pie isn't going to make a difference in your cancer risk. But if you have chronically high blood sugar, high insulin, and high IGF-1 levels, that will make a difference. So when it comes to sugar, your best bet is to decrease your overall consumption of sweets, breads, pastries, anything that tends to boost your blood sugar levels. And what about whole grains and legumes and fruit? Well, these foods tend to contain more fiber, so they increase your blood sugar levels less than the obvious sugars found in breads and pastries and sweets. So if you are craving something sweet, grab a piece of fresh fruit, and instead of sugar, honey, or syrup, choose stevia or xylitol as sweeteners. They're much better in terms of blood sugar levels. If you'd like to learn more about the MammAlive Foundation and the resources we offer, check out mammalive.net. And if you'd like to learn more about naturopathic breast cancer care services in Waterloo, Ontario, you can find me at healingpathcenter.com.